Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah Sarah and Court, Dublin, California 94568, and phone number 408 687 1899. Email address homeomedicine HOMEOMEDICINE @yahoo.com. Anytime when you are suffering from any disease and not getting any progress in your treatments, for second opinion, you can call me at 408 687 1899. I can guide you according to the natural principles. Where the progress of your treatment has stopped, what are the hurdles in the cure of your disease, and all that based on the natural principles. Because when there was no medical science, even then persons were suffering from diseases and were cured. Who cures at that time? Now there is a medical science, we have advices, we have medicines, we have directions and everything. But at that time there was no medical science, and we do not know much about the herbs, medicines, and at that time it was the nature. Even without medications, people were getting well. They were suffering, no doubt, but they were getting well even without the medications after a certain type of periods, which was not known at that time to the human beings. Just like we have the fungus, we have the parasites, we have the bacteria, we have the viruses as well at that time. And at that time we were not knowing the action of these type of disease producing organisms, and how long they remain inside the body, how long they work inside our body and produces the disease symptoms. But now most of the things we know about the bacteria, we know about the protozoas, we know about the fungus and also the parasite as well. And according to that we can guide to the humanity that if it's a viral disease, if it's a bacterial disease, if it's a parasite disease, if it's a fungus disease. So according to that we can guide the suffering peoples, and we can let them know that how long it may take even after the start of the treatments. Even the progress has started with the medications, even then it will take that much time, but now we can forecast it. But still, there are some chances that we know all these things, but even then, there are some hurdles of the disease, and some hurdles in the cure of the disease, that we have to identify it. And the identification, first of all, the causes. We must know about the causes which are causing the disease, particularly in this body. When any change occurs, it is represented by the symptoms, sensations and feelings. And if we are able to collect those sensations and feelings, we will be able to find out the cause, reasons behind that one. Who produces it? Who is responsible to producing these type of sensations and feelings? Or, as we know nowadays, that if ever we make a survey of our body, we make a survey of our day, at least 72 hours, whenever you fall sick, from backward, if you make a survey of 72 hours, what has changed in your routine of eating habits, working habits, in general, it will give you a clue that what was the reasons behind your disease. Something you will find it out that it was beyond the limits. Something you will find out that yes, in a routine we were not doing this thing. In a routine we were not doing that long, that exercise, that exertions of the body. Or even if you go to the food sides, you know about that one, that yes, we were taking a routine food, and within these 270 72 hours we have done something extra. We have done or we have eat some special type of food, and just possible the routine food was not causing any problem to our body, but now we are suffering because something was wrong inside that food, or our body is susceptible to that food, and that is why the body is responding in the disease symptoms. So ultimately the body itself is capable of removing all those symptoms, or the removing that reaction that caused by that substance which was not a routine of your body, a routine of your food, a routine of your behavior. But ultimately it will take little time, even if you do not take any medications. In a due time it will go off, and you will be healthy after that. But sometimes what happens, you do not know about those things which are causing the disease, and ultimately I can guide you how to do the survey of your body, how to do the survey of your routine, daily routine of your life, how to survey what you have taken in food, or what may be causing out of the food which was not your routine, and you have eaten that one and it is causing the problems. So in this way I can just help you to find it out what are the reasons and when they appeared, and how you can remove them. So ultimately, if ever you are not getting well in a due course of time, there are some reasons behind that, that the body is unable to respond to cover all those type of causative effects, and you have to help the body in that way. Take away the pickles, take away the highly spicy foods, take away the excess of salts, take away the excess of sweets, and whatever you are eating, and which is not your routine of life. Because whatever is your routine, normally the bodies are accepting those things, and bodies are adjusting those things, and they are okay with that one. The normal procedure of life goes on with that type of food. But whenever there is a change in the food, change in the habits, change in the environments, all these things are causing some type of changes inside the body, and the body response is not sufficient to overcome easily about those one. And how it is not sufficient to overcome the disease, that's why it's taking long time to recover. Otherwise everybody is responsible. Everybody, whatever goes inside the body, whatever affects this body, in due course it is designed in this way that in a short course it evacuates from the body, by stool, by urine, by sweating, by perspirations. Everything which is unwanted has gone inside the body. It is removed from the system, removed from the body, and you get well soon. But sometimes there are hurdles that you cannot remove everything which was causing the problem. You might have eaten that one, you might have faced the environment, you might have done extra things which was not your routine. So all these things will take a little longer time to recover. And that is what I can guide you, that why there is a delay in your cure of any problem when you are suffering from many things. I will do my survey, and I will do survey of your life, and ultimately I will find it out what's your routine, and what was the change in your routine within 72 hours of that one. That will give you a clue. But sometimes in a chronic type of diseases, there are some other causes, because just like I told you about the viral diseases, the viral diseases have 4 days incubation periods, and the total period of the viral diseases are 21 days. And I know that within 21 days it automatically will go off, but still there are chances that it may kill anybody within that periods if it is complicated, if it is complicated with anything. The same way, bacteria, viruses, and all the disease producing organisms are having their specific food, their specific environment, which they develop inside the body. And if it is not provided, they will be gone, just like the tubercular bacillus. That's known as the fast bacillus. It has its own media to survive. It has its own environment to survive. And if we will cut off that survival media for that one, automatically the tubercle bacillus will go on and will not grow further. And no doubt, nowadays medicines are advancing in these fields, and there is, I think, the tuberculosis has been eradicated most of the cases, but still there is chances, because still there are that kind of environment inside our body prevails because of our eating habits, because of our food habits, because of our living habits. It has changed. So the basic thing we have to find it out, that it's acid fast bacillus, means it survives in the acid. So if ever we know about that one, what type of bacteria it is, and what's the survival environment of this one, and if we take off that survival environment for that one, automatically that will die. This is one thing that we can guide you if your treatment is not effective, because treatment most of the days nowadays, what's going on in a modern medical sense, you can say, I'm not talking about the homeopathic or ayurvedic systems, I'm talking about the modern medical sense at this time. Until and unless the system has not found any type of disease producing organisms inside your blood, inside your excretas, and all that, they cannot claim that we can cure this one. And at the moment, from your blood, from your sputum, from your stool, from your urine, if they find it out that this is the organism which is not the routine of stool, which is not the routine of your urine, it has come up. It has come up in the blood. This was not the condition of the, because we know the biologically what's the composition of the blood. If something has changed, pH level has changed, or some type of cell counting has changed. Different type of cells are there, and there is a numbering of that one, the ratio of that one. If that has been changed, ultimately something has increased or something has decreased. So this will help us to figure it out, that what are the reasons. Just like, suppose if a person is coughing, person is having this kind of conditions, we will see in the blood test, we will see the lymphocytes are increased. We will see eosinophil is increased. All the respiratory problems and all that one. And why eosinophil is increased? There is a specific type of environment which allows to flourish this eosinophils, or kill the eosinophils. And ultimately, if we know about that one, then we can guide you side by side with the treatment. You have to take these type of precautions. But I'm talking about that the modern medical science, they have just targeted, if they find out any organisms inside our excreta, or in our blood, in the sputum, in stool, any urine, then they claim it. Then they find it out, any type of substances, I mean any type of chemical which can kill this kind of bacteria, this kind of viruses, this kind of conditions they can recover. Just like even sugar, they know if there is a sugar excess coming in the urine. Previously it was only by the urine, but nowadays we have A1C and many other measurements that we can judge from the blood that the sugar is increased in that way. So they are just trying to neutralize the condition. I just want to convey this thing, where you must keep in mind that they are trying to just soothe down the conditions, how we can bring it to the normal. And the second thing, just I told you, if they find it out that in our blood something is changed, how it is changed, what are the reasons behind that one which can change this kind of composition of the blood. Urine, we have a normal composition of the urines, but specific gravity and all that then. But if it is changed, what may cause the change of specific gravity, change of color of the urine, and the contents as well. So all these things guides us. But I'm talking about the modern medical science. they do not claim that we know about the disease until and unless in every disease they find out any organisms, Pro- fungus, protozoa, bacillus, bacteria, or the viruses, because their treatment is based only on killing the organisms. And and why it is not successful? It is successful immediately. It recovers the conditions immediately. Yes, in case of emergency, yes, we need these kind of things, that if it has increased beyond our limit and causing the problem in our normal go of life, immediately we need that kind of relief so that we can survive. But ultimately, this system is not a curative system, because we start the modern medical science. When I say we, means the medical, we are talking about the medical science. So the medical science starts their proper treatment based on the organisms they find out, and the medications are selected which are capable of killing these kind of bacteria. And how you can imagine that the medicine which is killing those bacteria will not kill your healthy tissues? Definitely. And moreover, inside our body, there are different kind of creations, creators, bacteria, which are normally the resident of our body. Many types, just like gut bacteria. We know that, the healthy gut bacteria. But if something you find, oh, it was a protozoas. And for the killing of the protozoas, what do? You try to give you the medicines to, when you find out protozoas, then you claim, oh, now we can be able to cure this thing because you have the medication which can kill the protozoas. But how you can imagine that it will not kill your healthy gut bacteria? And if they will kill the protozoas as well as they will kill the healthy gut bacteria, and definitely it will make it trend continuously, that something will change, something will increase, and ultimately the gut bacteria will die. Ultimately, what was their functions for the food digestions, it will not be properly, and ultimately you will get some more symptoms, even though the protozoas are killed once. And you say no, there is no any protozoas, we cannot see any hookworm, pinworm, whatever it is, and cyclostoma duodenum and everything that has gone, that has been killed with your medications. But side by side, medication has killed your gut bacteria, which are the normal resident of your intestines. And similarly, well, I can give you one more example. Just like in the female vaginal area, there is a Dauderlin's bacillus. They are the normal resident of that one. And to clean the vagina so that there should not be any infection prevailing. And ultimately, when you give something, some type of antibiotics or some type of anything which can kill the bacteria, ultimately the Dauderlin's bacillus will be killed more than their normal limits, because there is a normal limit of the Dauderlin's bacillus, which are the resident of the vagina. If they are decreased, they produce problems. If they are increased, they produce problems. And and with your medications, which was only designed that it has to kill the bacteria, ultimately it is no ratio that how much bacteria, normal bacteria, will be killed inside the body. And ultimately, if the normal bacteria will be killed inside the body wherever they are, ultimately it will create another problem for you. This is known as complications, okay, or the side effects of those medications. This is what's happening. Whereas I can guide you about that one, that it is not only that you can treat the diseases only when you find out any bacteria. No, there are some other chances. There are some other routes to go to cure the diseases. Just like anything goes in your eyes, immediately your finger goes to the eye. Anything goes inside your nose, your finger goes inside the nose. You touch it. And whenever anything enters inside your system, it produces sensations and feelings. If physically, externally, you cannot reach to that one, it has gone inside, and the inside reaction has been. Suppose if you have taken spicy foods, excess spicy foods, ultimately when it go inside your body and the body is not accepting that quantity of the spicy foods, ultimately it will produce symptoms. It will, the reaction is a separate thing, but it will produce symptoms at the same times. And good thing is that every healthy person, even after a minor change in their eating habits, in their living habits, in their environmental change habits, they produce symptoms. They are so sensitive that they produce symptoms. And if we are sufficiently intelligent to collect those symptoms, then we will be able to cure with homeopathic medicines, because homeopathic medicines are not designed on the basis of bacteria, that this is a tuberculosis medication, this is a parasitic medication, this is a fungus. No, it's not. It's not selected on the basis of any bacteria or anything else. It is selected on the basis of symptomatology, sensations, and feelings. And whenever homeopathic medicines are proved, these are proved on healthy human beings, and they are known as provers. They are known as provers. Provers means, one, I think, I can again give you one example. One is normal sensitivity. Normal sensitivity of the body is that everybody feels that if there's a cold, everybody feels cold. If there's a heat, everybody feels heat. It's normal. And when there's a grief, everybody feels grieved. Or if there's a happiness, they are enjoying that thing. This is the normal sensitivity of the human beings, of our normal life. But if ever anything changed in our environment, ultimately body responses to that and produces some symptoms. Just go to the any house where somebody has just died. Their face expressions, their feelings, their sighing respirations, and their movements will tell you the story that something has happened. And this kind of things has been proved by the medicines. There's no anything death, there's no anything happens. But even then, there are medications, when they are given to the healthy persons, they can create an environment of the healthy person, just like something has happened. Or not only the sorrow I am talking about, even the happiness. There are many more medications which can produce an environment of inside your body that you are happy mood, even though there may be many problems in that one. But when you take that medication, that medication produces the symptoms, and ultimately you feel happy, you feel strong. That has been experimented many a times on the healthy persons, that if that medication is given to them, they start laughing. They are jolly boys, they are working like that one. But when the effect of the medicine is over, they are sad, desperate. All these things happen. That has been verified by the homeopathic medications. And normal sensitivity, I was talking about the normal sensitivity of the persons, that is the sign of health. That is the sign of normal human beings. That everybody should feel that if it's a salty, they should feel it's salty. If it's a peppery, they should feel it's peppery. It's a sweet, we should feel it's sweet. It's normal things. It is a normal thing. But sometimes some persons are oversensitive. This was the sensitivity. The sensitivity is the sign of life. That body will not give you that is a peppery, it's a sweet, it's anything else. But if person is living, this is the normal sensitivity. But sometimes some persons are more sensitive oversensitive, and many things which are concerned with other people's, but they do not feel it. But some of the peoples are here that even with the minor type of things, even with the minor type of incidents, they are grieved, they are sad. I don't know what will happen to them. They are very sad. So, or if even in the eating habits, they feel it's more salty. No, I cannot eat it. Even then, the other people are eating that one. Oh no, it's very peppery. No, I cannot. I cannot take it. And whereas the other people are taking the same food, same spices, and all that one. Same thing. This is known as the oversensitivity, and it's only possible in the healthy human beings. So these kind of persons are selected to prove the medications, so that even after a minor dose of medicine, their sensitivity is stimulated to produce the symptoms. If you take a pepper, you might have seen that there's a sweating. Inside, you feel peppery, irritation in the throat, and all that one. Outwardly, you'll feel there's a sweating in the face and all that one. What is this one? This is the response of your body. And the same way, this is the symptoms for us that this peppery thing, whatever was given, is capable of acting on our body and is capable of producing this kind of symptoms. And even inside burning after taking peppery things and all that one, these are also the symptoms. And in this way, oversensitive peoples are selected to you can say, the verify the effects of this kind of substances, because we do not need to give more medication. Even the smaller doses of the medication, they are sensitive people, they are oversensitive peoples, and the smaller dose of that one can stimulate their vital functions, and they will be able to produce the symptoms, and those symptoms are our guide. And now there's a big collection of medications. More than 3,000 medications has been proved so far. There are many more, but verified. These medications are verified. Even verified means when a medicine is approved that this can do this type of changes inside the system, and when any person comes to us with a similar type of symptoms and we give those medications, ultimately, if those things are relieved, contraindicated, if those things are relieved, it is verification. So nowadays there are more than 3,000 medications which are worldwide used as a homeopathic medications, and we know their effects, that this is their effect. And if this medication is given to a person, he will, oversensitive person, will produce this kind of symptomatology, this kind of sensations and feelings inside the bodies. And we know the quality of the medication. Yeah, this is the quality of the medication, that it can do this thing. But when any person is suffering from any disease, whatever may be the reason, mosquito, we know that after mosquito we have a malaria. But we know that what's malaria? Malaria is a reaction produced after biting of the mosquitoes inside the body, or the response of our body against the toxins of the malaria, and we feel chilliness, we feel high fever, we feel after that sweating, and the fever is down. This is the routine of the malaria, as we know that. And we are not supposed to give them a touch of malarial parasite. No, there is a nature's principle. Nature's principle is that a weaker dynamic affection is completely extinguished by the stronger one when both are different in kinds. Malaria was produced by mosquito, but medicine is not malaria, not the mosquito. But this medicine is capable of producing the similar symptoms which are produced after the parasite bite. Of the malarial parasite bite, body responses in this way: shivering, chilliness, fever, all that one. And we have now medications which can produce similar type of symptoms if these are given to a healthy person, oversensitive persons, healthy persons. They can also feel chilliness, sweating, high fever, and all that one. So, what does it mean? That kind is different. Malaria is produced after biting the mosquito, and whatever response of our body was: shivering, coldness feeling, high temperature, sweating, fever goes off. This is the routine. This, that body responses to that one, and then ultimately it covers to that one. Okay, after the sweating, fever will be gone. Means the action or the reaction of that malarial parasite is neutralized in this way. And now we have medicines in our stock which can do the same thing, which can produce chilliness, which can produce high fever, which can produce sweating, and the fever will go off. Means a weaker dynamic of function is completely extinguished by the stronger one when both are similar in their manifestation. Malaria was producing, mosquito was producing malaria type symptoms, similar in their manifestation. This was the manifestation of malarial parasite toxins. And we have the medications which can stimulate our body with the similar manner, same way, with chilliness and all that. But now, what's the difference? The difference is the mosquito bite has gone now. We have taken care of that one. We have taken the precautions. Whatever it has to do, it has done already. But it's coming time and again. Then what we need to do to give some medications which can produce similar type of symptoms. What's the difference between that? We are we are doing the same thing. No, there is a difference. Difference is that the control of that medication is in our hand. Malarial parasite was not in our hand. Now medicinal power is in our hand, and we just give the medications and produce those symptoms. And ultimately there's the sensations and feelings of the persons that after taking these medications I have the same type of reactions, and immediately we feel this thing, we can withdraw the medicines. We withdraw the medicines because it is in our control. But there's no malarial parasite over there. There's no mosquito over there. That has gone. And that was a weaker dynamic affection, which was produced by the mosquito. Weaker dynamic affection because it has once hit our body, bite our body, put their toxins inside, and acted inside. The body has a response to that one. But now we have the medications which can produce similar type of symptoms and in a stronger or greater quantity. And whenever a patient realizes that I'm feeling more chilly, I'm feeling more heat, and ultimately this is an indication, supervision. So with the supervision, this is an indication that this has happened. Then what we do? We can withdraw the medications. When we withdraw the medication, automatically, the weaker dynamic function was completely extinguished. Weaker was the mosquito bite. Weaker was the toxin produced by the mosquito inside our body, and that has been neutralized. Simple thing. Just like any disease a person is suffering produces symptoms, and these symptoms are first of all, the first symptom is the mental symptom. It is the known as subjective symptoms, and it is only felt by the suffering persons. No one else knows about that one, what he is having. Only the suffering person feels, yeah, I'm not feeling well. My body is not okay. I do not want to work. These kind of things initially happens. And when we inquire, that nobody else knows, when we inquire about that one, what happens? Why you are not feeling well? Why you do not want to go to work? Why you are feel lazy or just like tired and all that one? Then he will explain the things. Ultimately, he will explain the things. I do not want to eat food. No. I am more thirsty. No. I do not want to take water. I feel feverish type of thing. I feel sweating inside my body. These are some subjective symptoms which he feel, but externally there is no sign. Externally, there is no sign he feels, and this is known as subjective symptoms. And subjective symptoms, we collect those things, and ultimately these subjective symptoms are known by or observed by the relatives, the attending persons. Oh, Doctor Sahab, when he has pain, he's turned double. He presses his abdomen, or when he has pain, he catches his head tightly. All these things, or he cries, or he's roll over. There are many more other symptoms that the attendants can tell you. Whenever he is having this kind of things, he does this kind of conditions. He does this kind of indications. So these are known as objective symptoms. So then, when we prove any medications on the healthy persons, these two things are taken into consideration after taking the medications. What you feel, which we cannot absorb from the thermometer, from the stethoscope, from the blood test, from anything. These are all the objective symptoms. What you feel, these are the sensations. These are the feelings after taking that medications. And in homeopathic system of medications, this initial disease producing conditions we record. That is known as mental symptoms. This is not considered of any value in any other science, maybe Ayurvedic, maybe allopathic, maybe any other science. They do not consider it. But this is the initial stage of the disease when it starts. And at that time, if a person is intelligent sufficiently, he can understand why this condition was produced. Why this condition was produced. And we can take precautions from that one. But whatever has been changed inside your body to combat that, and you need to give some medications for that one, that will be based on those feelings, what he feels. Because the medicines are approved on healthy human beings, and after giving that medication to the persons, he has produced this kind of symptoms. And after that, also the objective symptoms as well. So this is the scientific approach, you can say, we have in homeopathic system of medicine, whereas this is not in any other science. Just like we were talking about the modern medical science, there's the allopathic science. Unless they find out any bacteria or any disease producing, because they think the disease producing causative factors are only the protozoas, only the fungus, only the bacteria, only the viruses. And these things are produced very late inside the disease, not in the initial stage. These are the fruits of the disease, not the root of the disease. These can produce a reaction inside the body, but it is the body. If mosquito bite to the dead body, will he be having any malaria? Will he be having any shivering? No. It is the response of our living body against any inimical forces, maybe from bacteria, from snake bite, from anything else, whatever it is, from eating any food, from going into an environment which is not suitable to us, reaction of body is produced against that thing. And that reaction is produced in the term of mental symptoms, subjective symptoms that only that person knows. But after that, this condition increases. This condition increases, and ultimately, he shows some of the indications which the other peoples can know of. Whenever he has cramps or pain, he presses abdomen. Whenever he has pain in the head, suppose if a person says, I'm having headache, how you can know that? It's only he tells you. He tells you that I'm having headache. But ultimately, when it will increase in intensity, he will tight up his head. Then the next person, family member can, oh, whenever he is having a headache, he bind his head very tightly. Whenever there is a headache, he goes in the darkness in the room and with no noise. If there be any noise, he will have more pain. All these things are the objective symptoms. We regard that one, and our proving of the medications is based on all these things. And we have a specific type of you can say logical approach to the diseases. If any person is suffering from, we have a logical approach to cure all those things. Whereas the allopathic system, till there is no bacteria, till there is no virus, they could not recognize anything, any protozoas and all that. They say we don't have any clue about this disease. And as far as they find it out from the stool, from the urine, from the sweating, from the breathing, and anything, they find out some clue of this kind of a physical type. It's a physical type. Even we see the bacteria in microscope. It's a physical things. Our open eye cannot see that viruses and all that. But now we have the ultra microscopic things which can see that one. So means physically, until and unless you find out, this modern medical science find out any type of disease producing organisms, they cannot claim that we can cure this. And whenever they find out this thing, then they find out some medications which can kill this kind of bacteria. No doubt, if there is a virulent condition of the disease, yes, they recover. They kill immediately the increased number of bacteria which are causing the problems. But rest assured and be ready for that one, that they are not killing only the bacteria, they are killing your healthy tissue as well. And ultimately, even after the killing of that particular type of bacteria, you need more treatment to recover your healthy organisms, your healthy cells inside the body, because they were also damaged with that medication, which medication has killed the bacteria and all that one. Whereas there is no such condition in homeopathic system of medications, because it's a different kind of things. Our medication stimulates your vital function. It's not a material thing. It is not a material things that which can hit the physical body. It's immaterial powers. And in this way, when these medications are given, these medications stimulate your body reaction, your body response against whatever has been happened and the disease has been produced. So when your body is sufficiently taking care of himself with the stimulation of our homeopathic medicines, ultimately it recovers. Ultimately, it recovers. I mean, suppose few people have gone to the rain, and one of them is having sneezing. The other one has sneezing, fever, body ache, and all that one. And the third one, he was also wet in the rain. He's not having anything. He did not have any problem with that one. What is this? This is the resistance of the body. This is the resistance of the body, which is given by the nature to us, which is given by the which comes from our genes. And stronger genes make us more stronger when we born, and ultimately that prevails, continue. continue. And if the persons are having strong immunity, even with this kind of disease producing exposures, they do not suffer from that one. But those who are having weak immunity, even if just simple they wet in the rains, they fall sick. And we have the medications which can produce they did not vet it, but we have the medications which can produce similar type of phenomena if those medications are given to a healthy person, or as if he is suffering from he has been wet in the rains, he's having headache, he's having red eyes, he's having watery nose and all that one. Whatever happens after wetting in the rains, this is a symptom, these are the symptom conditions. And we have the medication which can produce these similar type of symptoms in a person if those medications are given. And what we do the same medication, we give the same medication, and ultimately when he start feeling something different from the, because now he's not wetting, now he's not wetting, but he feels like that one, then immediately we think that our medicine has a stronger influence on his body, on his mind, and ultimately we withdraw the medication and person becomes healthy. So this is a normal logical approach of the homeopathic system of medications. And our chapter today was, because this was the question arising to me, so I clarify that. What's the difference between all other systems and homeopathic system or treatments? Logically, we can prove all these things, that this was because of this one and how we can combat this one. So this is, I told you about the allopathic style of treatments, that they are only influential when, you can say, when this is they find out any bacteria, any viruses, any disease producing organisms, and then they claim, oh, we can cure this one because we know that this bacteria will be killed by this medications. But before that, he was also suffering. Just like I can send you the typhoid, vidal test, many other tests, they become positive after their incubation period is over. Typhoid test, it is positive after 10th day. And 10 days, a person was suffering from fever, from appetite decreased, from tiredness, body ache. All these things are the symptoms of typhoid. He was suffering. And we cannot claim that we can cure because we cannot find out the typhoid bacillus on that one. Whereas the homeopathic medicines can cure the diseases even if they come across in the initial stage of the disease. In the initial stage of disease, if you find out these kind of symptoms, even there is no bacteria, nothing else we know about, it may produce later on if the disease linger on. Otherwise, we do not know about that one. So in these conditions, this is the only system, that is the homeopathic system of treatments, which can cure patients only with the subjective symptoms. Only what the patient say is important. Whenever we take history of the patients, we take the history on these lines. What the patients say is more important. Whereas in other systems, maybe Ayurvedic system, maybe allopathic systems, they do not consider it. But you say, oh, forget that, yaar. I know that you have this bacteria and you have this and kind, and oh, you have a cough, pit, vayu. This is what you have, that one. And if you recognize that, then yes, we are having medications which can relieve your excess of cough, which can relieve your excess of pit and all that one. They will consider only that one. But these things are not initially changed in the body of the sick persons. It takes time. If it is not recovered, whatever the influence they are having, if it is not recovered, ultimately your kapha pitta vayu is increased. But what in the initial stage? Initial stage, the person is suffering from and he feels something which is not recognized by the attending physician, by the attending relatives or family members. He only knows that I have this kind of things. And What the patient says is more important, and this is important for homeopathic system of treatments. And the homeopathic system is having medications based on this type of things, what the patient say. All homeopathic medicines are having this kind of explanation, or the symptoms produced after being sick, and those symptoms we record from the history of the patients, that what are the initial thing for a sick person, and we have to choose those things, basic things, where the disease has started. Ultimately it will change the function of the body, it will change, bring up some other bacteria to grow inside the body. These are the later things. But why should this sometimes one of my professor was saying that once a patient suffering from any simple cough and sneezing, go to the chest specialist, and chest specialist examine him and said, no, yeah, there is no bacteria, there is nothing, anything what I can do. I'm a specialist. When there be any pneumococcus inside your body, when there be any tubercular bacillus inside your body, then come to me, I will treat that one. Now I'm unable to, for these sneezing, tiredness, all these things. Why I don't have them? So these are the initial symptoms, and this is the only homeopathic system of treatments which can start treatment, can cure patients even in the initial stage of the disease. And it's very easy. When any dispute starts, when any dispute starts, if you resolve the issue at the same time, it's very easy. It's very easy, the same thing. That's why sometimes it happens in the disease, and that they go to the homeopathic doctors, and expert homeopathic doctors select the medications on the basis of what the patient say. That is the subjective symptoms, and they are cured quickly. Even sometimes the stone in the body, sometimes very serious conditions which were thinking about those things, but because what the patients say, it remains continued throughout the course of the disease, whether now it has bacteria, viruses, protozoa, fungus, whatever it has been come up in the system, which was not previously. When the disease started, these bacteria were not there. They are produced later on, after the incubation period of the diseases started. So, but at the same time, when a homeopathic doctor take those symptoms, even there is a now bacteria, even the disease has advanced to the bacteria, to the viruses, to the whatever thing is there, but still these initial symptoms which the patient was start feeling in the beginning of the disease remain continue until the disease, until the disease. So in at any condition of the disease, any condition of the disease, we try to take up those symptoms from the person, which are the initial symptoms, which are the subjective symptoms, what the patient says, and nobody has any explanation. Nobody other knows about this thing. It is the only subjective. The suffering person knows about that one. That I feel this kind of thing. And when you find out this kind of things, ultimately ultimately, if we select the medications on the basis of these subjective symptoms, whatever may be the pathological change, whatever the lab test can tell you, oh, there is a damage in the lungs, and there is a damage in the heart, or there is a damage in the intestines, whatever it is. Just like I can give you one example of ulcerative colitis throughout America. I think all the people listening, they can verify this thing, that ulcerative colitis is not cured by any other medications. It's by the homeopathic symptoms, and not that if the person comes in the initial stage, it take a movement, it's cured. But if the disease has advanced, and they have their test, oh, there is ulceration inside the intestines, or no, it has rotten your intestines, and ultimately we have to cut the piece of the intestines and all that one. There is a heavy bleeding from the stool, before this tool, after this tool, and there is a pain in the abdomen all the time. All these things are the advancement of the disease. But if it goes to the homeopathic system of treatments, under this condition, the other systems say that no, it's not a curable disease. And they are mostly in all the conditions, rheumatoid, arthritis, this and that, psoriasis, they are put on steroids. But ultimately, in my 52 years of practice, I have noticed that, and none of my case has failed in this one. And I have treated those cases on the basis of what the patients say, the initial symptoms, which was started in the beginning of the disease and are still continued, even if the disease has produced increased up to the level of ulceration of the intestine, up to the level of regular bleeding from the anus, and doctor says, oh, it's ulcerative colitis. It's ulcerative colitis. When they say the name ulcerative colitis, they say, oh, it's incurable. Oh, this is cancer. Oh, when this is diagnosed as a cancer, patient is half dead by the name of the cancers. And ultimately, patients are coming to me, the brain tumor, cancerous tumor with malignant, when there were two or three times surgery of the brain, but it is not cured, it's reappearing. Breast cancer, prostate cancer, rectum cancer. I have cured here in America, but I cannot claim that because I did not treat the cancer. Cancer was a development condition of the disease with the definite changes in the system, definite changes in the cells. That is why they are taking the biopsy of the cells and they, oh, these are the cancer cells. Disease has progressed from the beginning to this stage, and they are treating this stage. They are trying to recover those things. But as a homeopathic doctor, we treat, we try to find out the initial symptoms because they are still continued. His feeling, his desire, his aversions, all these things. And on the basis of this thing, we select the medications, as I told you, we select the medications which may be of the stronger power as compared to the influence of the disease on the system. Because disease has its own influence on our system. That is why it's producing symptoms. That's why it's damaging inside our body. And in this way, it's not curing. Damage is increasing, damage is increasing, but the initial symptoms still remains there. And if you treat the patient on the basis of initial symptoms, what the patient say, even at that time there are symptoms that what the patient say is listened, and the medicines are selected on that basis, yes, patients are cured. And here in India, you can say, no, 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 it was not cancer. No, no, it may be something else, smaller tumor or anything has been cured. These homeopathic doctors are claiming that we cured. No, no, it's not. But here in America, you know that every person goes to the hospital and has a big, big record of all these things. And they come to me. And I have a record of all those patients: breast cancer, uterine cancers, and prostate cancers, and squamous cell, nose cancer, intestinal cancer. What I'm telling you, I have cured those patients, and they are still surviving and they are normal. Brain tumor, malignant tumors as well, they have been cured with homeopathic medications. And they are cured by taking into consideration the initial symptoms, what the patients say. I was not concerned with the name of the disease. I'm not treating the cancer. I'm not treating any by name of the disease. I'm treating the symptomatology, the influence of that disease produced or shown by the sick person. His organism has shown. So all these things, there's a difference between homeopathic and allopathic and Ayurvedic system of treatments, and it's a different approach. That's why I say always, when you are tired of any disease at any age, and you are not getting any progress in your disease, please call me 408-687-1899, and I can give you the clues. What is the hurdle? What is not being cured? And you will get well soon. Call me at 408-687-1899. My phone number, this is what, and my clinic address is 9701 Sarah and Court, Dublin, California, 94568. Phone number 408-687-1899. And always, I request to all of you listeners, please convey this message to all your nearest and dearest so that they can join me on my Facebook, they can join me in my YouTube channels, and also on Sabarang radio station, and can listen all these lectures every day. These are from 5 to 6 p.m. California Pacific Standard Time every day, and I'm delivering these lectures since 32 years in America, from head to heel, different diseases. If you go to my YouTube channel, you will find thousands of lectures in this way, in Punjabi, in Hindi, and English. All the three languages, you can find that. In whatever language you want to listen about diabetes, you can listen that. In whatever language you want to listen about cholesterol, you can listen that one. In whatever language you want to listen about the cancer, whatever it is by the name, but rest assured, we do not treat the disease by name of the disease, because diagnoses are made only after taking few important symptoms of the disease, how they have changed the systems, but not the whole sum of the history. And the whole sum history has its beginning, has its beginning in the subjective symptoms. And that is the base of that one. And we treat the patient on the basis of subjective symptoms. So for that one, you can call me 408-687-1899. God bless you all. We'll see you tomorrow. Today there was a lecture of a lower abdomen. I was supposed to discuss the lower abdomen in English, but I will discuss it tomorrow. Excuse me for that one, because this was question arisen in front of me to describe what's the importance of homeopathy in the system of treatment. So this is what I have explained you. So tomorrow it will again in English. It will again in English, the lower abdomen I will describe. Thank you.